8 months ago, Jim almost died when a blood clot reached his lungs. He agreed then to let his doctor do a surgical procedure to prevent future clots. It has prolonged his life.
Hey, Jim.
Hi, Dr. Johnson.
How are you doing this morning?
Fine.
Good.
But today he has come to see Dr. Pierre Blanchard with a different agenda.
I need to know what my options are. I guess what I'm concerned about is when I get to where I can't basically do anything but breathe and barely swallow and have to be just somebody take care of everything I do. I'm concerned about where I go from there and what you can do for me, if anything.
I mean, anything we can do as far as comfort care is concerned, I think we can do that. And I think we can talk about hospice at some point.
I don't want to go to hospice.
I mean, do you obviously know exactly what hospice entails?
I don't.
Well, I think I do, but
it's pretty good. I mean, they will keep you out of distress.
They'll even send you home with a morphine drip. And, you know, if I can get to it and to where I push the button enough and everybody else is out of the room, well then, you know, so what? It makes no sense to me that you can do things like that and get away with it. And why we don't just change the damn law and get things different.
Well, I guess there's such a moral, religious issue here in the South, especially about suicide, too, that's probably impeded some of the progress in those areas.
What would you do if you were in my position? What would you want done?
Well, I want to be kept comfortable, that's for sure. I don't know if I could say what I would do. I can only tell you what I can do as your doctor, but I can't always say what I would do as a person. I guess you have to be put in that circumstance. It's not real easy to say, you know, I would do this or I would do that. I have a great deal of empathy for the things that are occurring, that's for sure.
Well, if the law were changed in Louisiana to be like the Oregon law, would you have any objection to that?
I don't know if I could kill somebody.
The only thing that I think is unfair is I'm going to have to do it before I would really rather do it. And that's not fair. I won't have to do it while I can still swallow and while I can still hold a straw and something like that. And there's no law against somebody putting something out in front of you and then me doing it. There's nothing wrong with that.
No.
Because that's me committing suicide.
Yes.
And it's just, I will have to do it before I really want to.
Well, I think there are definitions of discomfort, and I still think that, you know, my experience with hospice has been that we can do things for people that don't keep things moving along for long periods of time. You just have have to trust me for that because I've seen it.
So the law will help me die slowly.
Well, not in 5 seconds, but you know, certainly not. I don't think dragging it out.
Okay, Lord, I understand the position you're in, and I know that. I just don't. I think it stinks. Just to be real honest with you, it's just. It's not a mature way to look at certain end of death or end of life situation such as mine. It's not a mature way to look at it.
But as your physician, it would be hard for me just to absolutely take you away, and it'd be my responsibility to shoulder that burden. I can assist you in making things comfortable. I can't really assist you in killing yourself. I think we should be all right.
All right.
Are you having any respiratory problems, breathing problems?
None that except the fact that I can't sneeze and cough like I used to.
What strikes me is that Jim Witcher is my age. And when I look at him, I see a reflection of myself, and I ask, what would I do?
Well, yeah, he asked me that too, and I said, well, I don't know. You never know until you're put in that circumstance. And that's not evading the issue. It's easy to agree with somebody if you want to, but I really don't know what I would do. I like life, but I don't know if I'd like that kind of life. I don't see much fasciculation, really.
What could you do for Jim?
I think that we can help give him support. We can help his wife by getting him help to help deal with him as far as his activities of daily living. I think if things progress to the point that he is in any distress, that we can give him medicine that will make him not be in respiratory distress. Can you squeeze? A little bit there.
But he then loses control over that decision, doesn't he?
Yes, he does.
And he seems to me to be struggling for control. He wants to control his
He
goal.
wants that, and he wants more than that. He wants more than what we're describing. I think what you say is true. He wants not for me to control the circumstance. He wants himself to be in control and to dictate how things go when that time arrives.
Is that an ethical problem for you?
It is.
Well, you took an oath to save people, not to kill them.
That's very true. I guess included in that oath, too, is to make sure that people have comfort and dignity in the way that their illnesses are dealt with, too. So there's a little bit of a play there between those two.
If you were free to help Jim, if the law were not in your way, what would you give him? Morphine?
Yeah, I think the most direct way is potassium chloride. It's not painful, it stops the heart, and it's quick.
But the law says...
That would be a real no-no.
That would be...
Because I know that we give people in terminal circumstances morphine drips, and whatever they die from, we attribute it directly to their illness, but I guess the reality is that morphine probably contributes to it when you have to get to a high enough dose to suppress the breathing process.
I think if I were the doctor, I could give him the medication, but I couldn't help him take it.
I could do that. I could do that.
You could give him the medication.
I mean, I could say, just this is for comfort or whatever, and he can do with it whatever he wanted to do.